Thanks a lot for the opportunity of being here. I feel part of this family. What I would like to share with you is really to give the industry's perspective into this arena. I love working with the group of Global Health at Merck, and I hope you will enjoy the next slides to share with you a bit more of what industry, and in particular Merck, is doing.
Mademba, Mala and Mamegora are just 3 of more than 200 million people in Africa suffering from schistosomiasis. The neglected tropical disease is triggered by parasitic worms, whose larvae are widely found in lakes and other stagnant bodies of water. Children in particular become infected with the disease. When playing in water, they are an easy target. Malnutrition, anemia, a lack of concentration and stunted growth. The infection also often leads to death. Since 2007, Merck has been supporting the World Health Organization, WHO, in the fight against schistosomiasis. The company donates Praziquantel tablets to WHO, which are then distributed at schools. This is to especially protect those who suffer most from the consequences of the disease. However, providing tablets is only part of the solution. Merck therefore supports an education program with the aim of preventing children from coming into contact with the dangerous parasites at all. At school, the children learn how the disease is transmitted and which bodies of water they should avoid. In addition, within the scope of a private-public partnership, experts at Merck are conducting research on a pediatric formulation of Praziquantel. At the end of 2014, Merck initiated the Global Schistosomiasis Alliance, together with other partners. The ambitious goal is to eliminate the worm disease across Africa and worldwide.
I don't know if everybody knows Merck. I also know there is always confusion because there are 2 Merck. I'm referring to the oldest biopharma and chemical industry, founded in 1668, based, it's a German company and still a family-owned company it's operating in 66 countries and quite a few employees. You could say, why industry in this area? I think there is a change. I mean, industry obviously needs to survive and be successful through a long-standing, profitable way of doing, but it's not all. Merck is very much committed to neglected tropical diseases. I would be even broader. I would call it infectious diseases, in view of the fact that we are also not only on neglected tropical diseases like schistosomiasis, but as well into malaria. That's one of the sentences that the Merck CEO, Stefan Oschmann, has pronounced during his settlement at CEO at Merck last year. So just to confirm that Merck is very, very much committed to global health. It's health in general is one of the 3 pillars of the corporate responsibility, together with culture and environment. But today I will really focus on health. This slide makes me feel as well quite proud because as you may know, there is a global exercise that is running every 2 years, which is the Access to Medicine Index. And it shows really the engagement of the company. In this last exercise, Merck was ranked overall number 4, with number 2 being in R&D. So that's really makes the company quite proud on the engagement that is continuing throughout the last years. Now, you will see the video later on, but the video would be mainly on the engagement on the fight against schistosomiasis. And you know how big is this challenge. Schistosomiasis is one of the most neglected diseases, with about 220 million of people infected, at least according to the latest WHO figures. And a big majority of those numbers are children. So that's why Merck is really, really focusing into the health of children. And I would add about mothers in a second. The commitment of Merck into schistosomiasis can be translated into various aspects. There is a donation program which is running as of 2007, and I'll tell you more in a few seconds. But that's not all. That has been complemented by other activities like the optimization of the current gold standard Praziquantel, which is the tablet being used for the treatment of schistosomiasis. There is also, and that's very important, the development program to have a new formulation of Praziquantel for treatment of children below 6 years of age. And obviously that can not only stop to development of drugs, but it needs to be surrounded by other aspects, including education. Now, as said, I would like just to focus 1 second on the donation program. As said, it's running as of 2007, and it's in collaboration with WHO, which does the link, the liaison with the local governmental entities in the countries for the distribution of the tablets, mainly in Africa and especially to school-age children. As said, the number of people to be treated, it's huge. So far, we know that 100 million of children have been treated. I talked about education briefly. So donation, in the context of the activities that Merck does within its corporate responsibility, is not stopping to the pure charity, but it's complementing those activities with education. And that's a comics that I hope you had the occasion to see already on the website of this beautiful festival. So that's a booklet, and I'm happy to share more with you later on, that is being distributed to educate school-age children in Africa. Now, let me move to my passion, which is global health, because so far we talked about corporate responsibility, but Merck has structured an entire organization called Global Health, because we need a next generation of medicines, as well as we need other tools like diagnostics, like medical devices, and also entering into the e-health world. So Merck, through the Global Health team, is trying to develop and deliver comprehensive health solutions. As said, we are not focusing only on treatments, but we are trying to explore new possibilities into diagnostics, devices, and e-health. What are the two main diseases so far? It's without doubt schistosomiasis, and it's also malaria. But we don't stop there. We are trying to broaden into microbial infections, and also looking at co-infections. For example, schistosomiasis is creating some other pathologies like female genital schisto, which has an impact even into the predominance of HIV when, especially in young girls, they become adults. As I said, this group is mainly concentrating on children and mothers, and all it's done in collaboration and partnerships with academia or NGOs in developing and developed countries. That's the integrated approach of the Global Health Team. 4 pillars, so we focus on detection, transmission with vector controls, obviously treatments with drugs and devices, and as well we try to have control program in Africa. One of the flagship program, and because I said the video will talk about schistosomiasis, I found it appropriate to share a bit more about the development program of Praziquantel Pediatric. So that's done in partnership through a consortium of 7 partners, all bringing different expertise. The aim is really to develop and give access to a new treatment that very, very young children can take. They need something that is oral dispersible, that they can swallow easily, and that can be given even to toddlers and very, very young children. So that's for the ones below 6 years of age. It's currently in phase 2. Which I believe it's an important news to give, so quite into development. And for all clinical studies being done, we try also to improve in terms of capacity building. All is being done in African countries, including the phase 2 now running in Côte d'Ivoire. Now, this integrated approach that I described in terms of health solutions cannot be alone. I really believe that there is a need of more and more awareness, more advocacy, more communication around those. So at Merck, we try to complement the integrated approach with 5 different pillars that are our focus. Obviously, there is an external exchange and dialogue that needs to continue, also through this kind of forum, which is fabulous. As an industry, we need to convince also people internally that helping the more neglected and vulnerable population remain into the ethical business that a company like Merck needs to pursue. So that's how we move forward. I just put some example on the screen. Obviously, I will be available for you during the day if you want to share more, and also including some of the material. I'm sorry. Now, communication for us means also collaborating, being partner. And that's just a screenshot of some of the institutes with which we are collaborating in Africa. And it can be for R&D platforms, making screenings of mini library compounds for new drug to go into development. It can be fellowships in different countries. So that's as a quite a broad scheme. And I just finish because I think I was given 10 minutes. I hope I'm into the 10 minutes. I want to thank you a lot. I'm only one of the representatives of the team, so I thank you a lot on behalf of the Global Health Team at Merck. Thank you very much.